One of the unique things about CMC is that our faculty are incredibly diverse and they come from all over the country, in fact internationally from lots of different countries. They have an amazing background, an amazing drive to teach and to advance the care of surgery, advance the science of surgery.
And one of the benefits of this program is that we do have a very good mix of female and male attending, so when a medical student is looking for residency programs, they can actually see the roster of who the attending surgeons are here.
I think some of the strengths of the program are really the diversity of the caseload. I think there are a lot of programs that will give you an adequate general surgical experience, but I think some of the true expertise and subspecialization of many of the rotations that each resident goes through really diversifies their operative experience.
We're a huge referral center for this part of the country. We're the flagship facility for Atrium Health. We're a level 1 trauma center, and we're an ACS verified level 1 trauma center, as well as a North Carolina State level 1 trauma center. With those things come lots of opportunities for surgical training, whether it's elective, emergent, trauma, what have you. But the other side of that is that we do a lot of basic general surgery too. So as a surgery resident, while you're doing complex surgical oncology, very complex trauma, multi-organ transplant, you're also doing a lot of basic general surgery. We have a great hernia program, a world-class, world-famous hernia program. A lot of great vascular surgery, advanced cardiac surgery. So it really covers the gamut of anything that you'd be looking for as a surgical trainee.
Some of the opportunities of collaborating with some complicated cases lends for collaboration in some of the not necessarily complicated cases. And with that, we develop relationships with not only the general surgical residents, but the other residents we work with, whether it's orthopedic, emergency medicine, urology, the neurosurgical residents. We all typically have some overlap in those cases, and the collaboration and communication is excellent.
From the attending standpoint, I believe, is a good source of respect. So there is always, at any sort of meeting that we've had, there's always respect shown between all the attendings. It's a nice discussion that they should hear from a surgery cultural standpoint. Even the culture of surgery has changed over time in history, and so we're seeing new faces, representatives from different groups, which is honestly a wonderful thing to see.
When I interview applicants, I tell them that this is your opportunity and the doors are open to do whatever you want. So any subspecialty fellowship that comes out of general surgery, we've placed residents in all of them. Yet, one of the things we take pride in is that when our residents finish our program, they're totally capable of going into general surgery practice on their own.
Residency, although we look at an 80-hour work week, the reality is the education doesn't stop. That desire to learn and follow up and practice and get better is really important, and I think we look for driven, motivated people.
Despite the strong academics and what we've shown nationally that we're becoming a powerhouse both in research and academics, that we feel like a small town family program, and I don't think that's going to change despite how big this place grows or how nationally or internationally we're recognized. That's the part I think that really will bring people in.